Ow. Ow. Oh, it's...
Oh.
So what he decided to do was to crack the knuckles on his left hand for 50 years, twice a day, and not crack the knuckles in his right hand.
So noise on its own then is fine. Like, I can continue with my dance career.
Oh, most certainly. I wouldn't want you to stop it.
No, I know. Hiya, and welcome to Strange Health from the Conversation. This is the show where we explore the weird and the wonderful things that your body gets up to. I'm Katie Edwards, and I'm Health and Medicine Editor at The Conversation in the UK. We're an independent source of news and analysis, and we're powered by academics and journalists working together to make evidence accessible.
And I'm Dan Bamgar. I'm a GP and a lecturer in health and life sciences at the University of Bristol.
And today we're talking about that sound. That sound that divides households, workplaces, and entire families.
Oh, joint cracking. Sets your teeth on edge just thinking about it, doesn't it?
No, I love a bit of joint cracking. Knuckles, knees, backs, necks. It's the noise that makes some people feel instantly relaxed.
And others instantly furious.
Now, if you're like me and you've ever been told to stop doing that or you'll get arthritis, you're not alone. Joint cracking has got this long-standing reputation for being bad for you, but is it actually damaging your bones or is it just noisy? Because to be honest, if it was actually damaging your bones, I don't think I'd have any bones left. I'm seeing joint cracking everywhere at the moment on social media, and there's videos of people cracking the necks, spines, and the fingers, and it racks up millions of views. I mean, who knew? It's often framed as releasing toxins. And realigning the body or resetting the joints. Shall I have a look down? Ow! Oh, it's...
Oh!
Ooh, that sounds like is that real? Is that real?
Oh, yeah.
Oh, is that real?
Oh, very, very much real.
Oh, I've got to turn that on.
Yeah.
Oh, that's put me about that. So it's this guy, a young man who has clearly got some considerable talent. It's like somebody you'd see in a circus in the best possible way. He's putting his arms all over his head and around and twisting them. But as he's doing it, they are cracking and making noises that very strongly suggest to me that he should not be in those kind of positions.
He's quite clearly got hypermobility. And when you have a look at the range of movement that his joints could reach, I mean, the shoulder's the most flexible joint in our body. It's a ball and socket joint. That's because we need to be able to place our hands in a variety of different places. Your shoulder's got the freest range of movement of any joint in the body. But even then, that shoulder joint was taking it to extremes. I have to say, there's sort of a general laxity in the joints and the connective tissues, which can enable some people to increase their range of movement. In doing so, it does sometimes make it more risky of dislocating the joint. In fact, the joint may well have dislocated in the middle of that clip that he delighted us with.
Dan, you're a GP. Should his joints be cracking that much? Because that is mega.
There's lots of different noises that our bones and our joints can make. There's almost an orchestral range of different noises that they can make. There's cracks, there's clicks, there's pops, there's clunks. Patients can describe them in many, many different ways. What we're going to be looking at today is what defines a clunk, what defines a crack, and what they actually mean, what's going on within the joint. Joints are really sophisticated things. They're not like simple hinges on a door or anything like that. They have lots and lots of different structures, and there's lots of things that can go wrong with them. But as we'll see, clunking and cracking of joints can not always signify disease or pathology. In fact, in the vast majority of cases, it's absolutely harmless and absolutely fine.
So I've got quite cracky joints. So sometimes my thumbs, and I have got ladle thumbs. So you can see...
Ladle thumbs? Yeah. What are they? Are they a new diagnosis?
Like ladle... Like,
oh, I
like
see. Yeah.
I could eat soup with them. Like, look, my hands are like relatively normal. And then my thumb, it's like little, and then it goes, woo, like a ladle. And I wondered if it's because sometimes it cracks. I wondered if it's because I'd got a big joint on that thumb. But my neck cracks as well. And sometimes I have to nod like that to make it crack. And eventually it does. But also, Dan, and you'll be fascinated by this, I know you will. When I walk down the stairs, my knees crunch.
Oh, same here. Same here. And I would say that my knees have always been a bit of a problem, but they've actually gotten better as I've got older. So when I was 17 and if I was knelt down on the floor, then my kneecap would pop out to the side. It would actually dislocate because the kneecap or patella runs in a groove in the front, on the front of your knee joint, and essentially it's quite shallow. And in some people it can pop out to one side, and as it frequently did in me, what I used to have to do is, after I'd gotten over the fact that my kneecap was round the other side, had to straighten my knee slowly, and then there would be a clunk as it goes back in again. And it can leave you at the same time. I said it's really sore in the middle of doing it, but I went to a physio who gave me some exercises, some really good exercises to build up the muscles around my knee, and now it doesn't do it anymore. And possibly as I've got older as well, my ligaments have become a little bit stiffer, and now I've never had the problem since. So it can be a problem that's there when you're young, and it can sometimes go away. But sometimes our joints can get more clicky. There's no rhyme or reason to it, really.
So why does it feel so satisfying then? Because I genuinely, I could not. I mean, my knees just do what they do. They don't give me any satisfaction as such. But my neck, when I'm in the car, I actually feel like I wouldn't be able to move my neck until I cracked it.
Mm-hmm. Yeah. It does cause real stiffness, doesn't it? And sometimes I think your joints do feel naturally quite stiff. It's like having a big stretch in the morning. It makes you feel instantly better in the morning and ready to get up and take on the world. But I think that's why joint cracking has become, for some people, that extra sense of gratification. We've got little nerve fibres which are in our joints, which give us an idea of the tension and pressure and position of them. And there's a proposition that perhaps the cracking of joints or releasing of pressure within joints can then be interpreted as relief by those nerve fibres. Certainly gives us a bit of a buzz of dopamine. I know certain people who become addicted to things like popping bubble wrap and squeezing spots and other bits and pieces. It's that sort of release of pressure that sort of gives them that instant sense of satisfaction.
So what's about this claim then that bone cracking can release toxins, Dan?
Can release toxins? Never. They're not, because they're not toxins. You're not, the whole process, aside from the sort of the bubbles of gas that are escaping from the synovial fluid, sometimes you get clicky joints because certain tendons or fibres are rubbing over each other or moving as the joint is moving. But it's nothing to do with toxins. There's nothing to do with any sort of toxic gases trying to escape from there. It's just your normal body's anatomy.
So to find out what's happening inside the body when a joint makes a noise, whether it's cracking or popping or crunching, I've been speaking to an expert in everything joints and bones in our Ask the Expert section. Let's get into it. Clodagh Toomey. So you're a physiotherapist and associate professor in the School of Allied Health at the University of Limerick. Welcome to Strange Health.
Thank you, Katie.
So, bone cracking then. I've got quite a bit of personal... I mean, I don't want to brag about this, but I do have very cracky bones. So when I'm walking down the stairs, my knees, it sounds like there's a percussion. What is that about? Why do your knees pop when you're not really doing anything particularly exciting?
I suppose the most common ones that might be happening in your knees, but the most common one that we hear people talking about is the knuckle cracking, the popping. So there's different classifications, there's different sounds. That knuckle cracking might be a little bit different from kind of more snapping sounds or grinding sounds that might be more kind of tendon issues. And then that might be different again to something that's kind of more creaking or grating or crepitus in the knees, which is also quite common. So those three things are a little bit different, and maybe we can talk about each of them. The popping noises that we hear, those, serial knuckle crackers, and people are, sometimes get a bit annoyed with the person in the room who's cracking their knuckles all the time. And then there's that misconception a little bit that, that's going to cause arthritis, so you need to stop. So what's actually happening there, if we think about the joint as being a place where two bones meet, there's a lot of other things happening within the joint there. So around the joint, we also have ligaments and muscles that are helping to stabilize and support and move the joint. But there's also a capsule surrounding our synovial joints. And around that, we have a synovial membrane. Within that, we have a nice kind of lubricating fluid. So it's a really kind of viscous fluid called synovial fluid. different things are in that. We have things like lubricant that help to lubricate the joint, hyaluronic acid, and also we have different gases that are dissolved in that viscous fluid. So just the normal gases that we have in our body, so oxygen, nitrogen, carbon dioxide. So what happens when we move a joint kind of past its typical normal range of motion? We're stretching everything. So we're stretching the membrane around the joint, we're stretching that synovial fluid. And what happens then is it creates a negative pressure within it. In that space, then, we have this bubble that forms. It's called cavitation. And that's basically filled with the carbon dioxide, the oxygen and the nitrogen. And when that bubble forms, that's the pop. That's the crack that we hear. So I suppose what distinguishes that from maybe a joint that's noisy every time it moves is that we can't really crack that joint again for about 20 minutes because it takes time for that gas to kind of dissolve back into the fluid again.
Oh, so if you crack, because another one, my neck cracks.
Mm-hmm.
And sometimes when I'm in the car, I've got this nodding dog thing where when I'm driving, my neck feels stiff and I have to nod it several times until it cracks. And it's quite gorgeous, to be honest. I really like the feeling of it. It hurts just enough. Just enough to give you that little hint of pleasure. But once I've done it, I can't do it again for ages. But that's different to my knees. My knees will just crack all day. But they're more like it's more like a crunching noise with them.
Yes. So also quite common. I suppose what I'd like to ask you is, do you experience any pain with that?
No,
and that's perfectly fine then. Yeah, so joints, tend to be noisy from time to time. In some people, it's more common. I suppose what we would look for is if there's any additional symptoms that go alongside that. So things like pain, things like maybe swelling, things like the joint locking might be an issue for some people. And that might indicate that there's a tear in maybe the cartilage or the meniscus, which is inside the joint again and helping to protect the bone surfaces. So that's might be an indication that there's a tear there if the joint is locking. But again, that might be something that somebody can live with perfectly fine. It kind of depends if it's affecting your function and your day-to-day activities.
It has affected my dance moves because I'm just a person who naturally feels the rhythm.
Mm-hmm.
And once it takes me, I can't do anything about it. And I feel it really deep inside. And you might say my moves are like Beyonce. I mean, that has been said. You wouldn't be the first one to say it. But the thing is, if the music isn't loud enough, you can hear my knees above that music. Is there anything I can do about it?
Potentially. So that what you're describing there, and it's not associated with pain. You can still dance, you can still move perfectly fine.
I mean, sure.
But there is, sometimes a psychological element with it, or sometimes an embarrassment when people, feel like, oh, other people can hear my knees being noisy. And then that suggests that maybe it is something that you can, go and get assessed and see if there's different reasons why that kind of creaking or crepitus is happening. So it's very common in conditions like patellofemoral pain, so which is kind of pain around the kneecap, and also osteoarthritis. That's not to say that people, that with these noises have those conditions, but there also might be issues with kind of tracking of the patella, so tracking of the kneecap, because that sits kind of just in a groove in front of your large thigh bone, so your femur. And sometimes if that's being pulled maybe one way or another, due to different reasons, it could be your foot position, it could be due to, hip muscles, it could be tighter muscles on one side versus another, then that can sometimes ease and get the patella back into position and reduce the noises that you hear. So it could be something like a stretching program or a strengthening program that might help you to actually reduce down those noises.
So what is crepitus then? Is that just the noise?
The noise is from crepitus. It's not well established, but it's generally, we think, from the cartilage that's moving.
So that's a particular thing. So that's not what they call all these different noises. That's just a very specific thing.
It's a more specific thing. Yeah, it's more kind of that creaking, grating, kind of crunchy noise. And sometimes you can feel it as well. If you put your hand over your joint when it's making noises, you can probably feel those vibrations as well. Yeah.
And whenever I'm sure anybody who's ever cracked a knuckle, or, when I nodded my head in the car with my mum and my neck cracked and she went, "Oh, was that your neck?" That's arthritis coming, that is. Which was reassuring, as I'm sure you can imagine. I like that. My mum's like that. She's a real positive support throughout life like that. Is that true? Will I get arthritis because I've got a poppy neck?
So we have no evidence currently to suggest that you would, just from cracking and popping joints in that way. I suppose the research that's been done, when we describe evidence and, the quality of evidence of there, it's probably on the lower quality side, because it's quite hard to conduct these types of investigations. Okay, so we'd be following people over a long period of time. So the types of studies that have been done have been kind of cross-sectional, so looking at one point in time, or maybe retrospective, where they'd be looking at people maybe with osteoarthritis and asking them, were you a habitual knuckle cracker, for example? And so you're relying on people to kind of self-report those. So the studies that have addressed that haven't found any link between joints popping or cracking and development of osteoarthritis. They have looked at other kind of hand function outcomes. So some studies have found, like for knuckle cracking, reductions in grip strength. Then other studies weren't able to corroborate that evidence. Some studies have found looser joints with people who knuckle crack a lot, but generally no difference in function. A really interesting study that was conducted. Have you heard of Donald Unger?
No.
So he was a doctor who was frustrated, again, similar to your case, frustrated by his mother telling him he was going to develop arthritis in his hands. He was constantly cracking his knuckles. So what he decided to do was to crack the knuckles on his left hand for 50 years, twice a day, and not crack the knuckles in his right hand for 50 years. So he refrained from doing one hand and just did the left. And he wrote this up and published it and everything. Investigations done, no arthritis in either hand by the end of 50 years. So that's just one person, but, it might give you some reassurance.
But that's dedication.
Dedication.
To being annoyed with your mum.
Absolutely. Yeah, you could say dedication to research, but I think dedication to just proving a point to his mum.
I know. I feel his pain, to be honest. So if you're going to have like any kind of red flags that go along with this, so it would be pain and it would be...
Yes, swelling. I suppose like if you've noticed that there's reduced function in one hand versus the other, like anything, everything in moderation is okay. But, I suppose if you're forcefully cracking your knuckles all the time, it might not be a great idea. And the studies that have been done, like, as I said, are kind of low quality. So if you don't need to do it, maybe, then why would you? And the other thing, I suppose, is, the psychological benefit that some people feel from it is kind of worth talking about. So that noise that people hear, that audible crack, it can be satisfying. It can be kind of self-soothing. It can kind of relieve tension. So there's definitely something about that. But there's, there might be other strategies by which you could relieve tension or find ways for kind of meditation or mindfulness that kind of help you in that scenario.
And does it do any good? Does it improve joint mobility? Like you were saying about having looser joints, is that necessarily a bad thing?
No, not always. It depends, I guess, and we need to make sure that we have enough stability around the joint as well, and that's really for kind of injury prevention and protecting us, I suppose, if we're to kind of take a stumble, that we're able to catch ourselves when we fall, that type of thing. So that's important, but, there's definitely evidence there to suggest that we get, increased range of motion, but it is temporary. So, after that 20-minute time period, at a minimum, it's kind of going back to normal again. So there haven't been major studies over a long period of time to say over a long period of time, people have more range of motion if they're cracking their joints. So I think, yes, it does provide short-term kind of increases in range. And within that, I suppose it can be used therapeutically as kind of tension relief. And it does, it's going to have an effect on your nervous system as well when you're pushing that joint into kind of an extreme range. So it might have an effect on the nerve endings. It might release down muscle tissue if it's, quite tight. But again, it's kind of a temporary effect. So you kind of need to keep doing it to get that response.
And is it because of the gas? Is it because the gas is causing stiffness, and so when you pop it, it's kind of relieving a bubble of gas?
Not necessarily, no. The gases aren't really causing stiffness as such, but it might be more due to muscle tension. So there's other ways that we could potentially relieve muscle tension that wouldn't involve cracking the joint or bringing it into a range that it's maybe not suitable for.
Clodagh, I've been watching loads of videos of people having like the body's manipulated, the joints manipulated, so they make the most horrific sounding cracks and crunches, and it seems like in the videos that's miraculous. It has this miraculous effect. So I've seen somebody walking in who could, really could barely stand up straight, and then there's this almighty crack to her neck, and then she's like, oh, I feel great. That's amazing. What is that the case? Like, should we not really be doing that? Should we not really be crunching bones to that extent?
There's not much to suggest that we shouldn't be doing it. I'd probably exercise some caution around the neck for sure. There's a lot of different structures in our spine that we need to protect, including the spinal cord and our blood supply. So I suppose making sure that if someone is getting a manipulation, that, the therapist is appropriately trained is really important. I suppose coming back to, again, that short-term benefit, and with that kind of psychological audible pop, that does provide that release. So if somebody is coming in and they can't move and suddenly they can, it's not really getting to the root problem. So it might provide that symptomatic relief, but most likely that issue is going to come back if it's not addressed from the root problem. So I think that's something to consider in terms of, continuing to get these, therapies that are, probably quite costly over the long term. Is it the correct way, or is it just kind of an adjunct, something they can add on to their treatment to try and get them over that first step and then address the problem, I think is key.
And is that just basically the same thing that's happening as when you pop your own joints?
It is.
Are they just doing the same
Exactly.
thing?
Yep. Yeah, it's the same thing.
Oh. So is there any evidence for sort of spinal manipulation for pain relief? Is there any evidence for that at all?
Yeah, there is. Yeah, for sure. And again, it's kind of along the same lines of relieving tension, maybe, providing, psychological benefit as well over the short term.
But obviously that must carry some risk then, if somebody's manipulating a spine.
Yeah, so the structures there, as you mentioned, the spinal cord. In the neck, we also have the carotid artery, which is the blood that's supplying the brain. So there have been instances of people, having a stroke after a manipulation. So that's, just something to consider as well. And is it something that really needs to be done to provide the relief, or are there other methods that can be used that are just a little bit safer?
So is there any evidence that kind of chiropractic cracking then of joints, does that help protect joints, or does it help prevent arthritis, or does it carry a bit of risk?
There is neither risk nor kind of protective benefits of chiropractic release, I would say. It's more to target symptoms than, we'll say, provide a fix for somebody, but it doesn't necessarily protect from developing joint conditions or pose a risk to developing osteoarthritis or anything like that.
As we get older, do joints just get noisier? Is that just something that happens when you're older? And is like, how do you know when it's just getting older and when it's like a kind of degeneration that you need to do something about?
There's definitely an increase in noisy joints as we age, absolutely. And that can be for various reasons. It can be, again, the cartilage that we spoke about, and over time, that ages and it's maybe not as healthy as it was when we were younger. And therefore, it can make some noises as we're moving our joints. But also when you think about the surrounding structures of the joints, so the muscles and ligaments maybe aren't as good quality as they were, again, in our youth. So that might cause extra pulls or pushes from one place to another. That can, again, cause that increase in noise. But if it's not accompanied, again, by pain or maybe, a reduction in strength, you're still able to absolutely fly up and down the stairs, then great. It's not something that should be of concern. And I suppose it's getting that across to people as well, and not to worry about it and not to be fearful of noise, because a lot of people might decide to reduce their physical activity because they think they're doing damage. And they shouldn't do that unless it is accompanied by that pain. It's absolutely safe to continue what you're doing. Just because your joints are noisy doesn't mean that you should stop.
Are there any supplements that help? Because I've seen, my brother suggested that I buy a load of collagen supplements and also a load of, what were they now? Like cod liver oil to try and improve my joints because they're so noisy. Would that actually do any good? Is there any evidence that it would?
Not any strong evidence to suggest it would. I think that there's some kind of weaker studies to suggest that it may improve joint health, but not specifically the noise of the joints. I know my husband, takes collagen as well, and he anecdotally says, yeah, my joints are less noisy. So I think it's worth trialing on yourself. If it's something that you want to trial for a period of time, see if it works. If not, don't spend the money on it. But if you feel like it's of benefit, then continue. And that's what we'd say for a lot of these supplements where there has been kind of larger studies done on, how it affects pain and function in people with arthritis. Over large numbers of people, we don't see a huge effect. But individually, people do report that it's of benefit, and they're safe to take. So that's the main thing. Yeah.
So if people do want to protect the joints long term, whether they're crunchy or not, what can they do to kind of protect the function of the joints?
Exercise. Our joints love movement. So like the cartilage in particular gets a lot of its nutrients through movement. So when we compress a joint and release again, that's how we get nutrients in and out of the joint, because it doesn't have a huge blood supply into the cartilage. So movement is really important to keep joints healthy. And as I said, everything in moderation. If you build up your activity gradually, it's a really nice protective way to reduce the incidence of things like osteoarthritis. Even if you have osteoarthritis, being active can reduce the progression of the disease. We know that. So exercise and physical activity is really key to maintaining joint health. And then things like eating healthy, and there's not one specific diet, there's not one specific supplement, but just maintaining a nice healthy diet following the healthy eating guidelines is what's recommended.
What is the single biggest misconception about joint cracking that you would like to retire?
Joint cracking. I think, the misconception is that it causes arthritis, and really we have no strong evidence to suggest that it does. So, myth busted.
Oh, I am recording that bit and I'm going to put it on my mum's phone. So every time she gets a text, that's what it's going to say. Thank you very much, Clodagh. That's been really great. Thanks for coming on.
Thanks for the chat, Katie.
Dan, that story about that doctor who cracked all his joints on one hand. I mean, obviously, I'm sensing a bit of tension in his relationship with his mother. Yeah. But what do you think about that?
Yeah, sounds like someone trying to win an argument. I mean, it's a great story, and actually one that, a really, really good self-experiment over 50 years or more. I know a little bit about this. The doctor in question was an allergist. He wasn't a rheumatologist or an orthopedic surgeon, someone who specialised in joints. But interestingly, when his hands were examined later in life, there was absolutely no meaningful difference between them, between the side that he'd cracked his knuckles on consistently to the side that he'd left alone. No increased arthritis, no loss of function, no pain in the cracked hand. And actually, this chap went on to win the Ig Nobel Prize. It's a satirical sort of take on the Nobel Prize. And it's sort of awarded for wholly unnecessary, but at the same time, really thought-provoking experimental results and findings. But yeah, I think the main thing to note is that this is in one person, so it might have been that he just got lucky. But it is a thought-provoking idea that actually, over that long period of time, especially with prolonged joint cracking, if it was going to cause problems, you would have seen them.
So, Dan, apart from this doctor with his cracking knuckles, you're always good for a case study. So when doctors actually look at, like, joint cracking in clinical settings, what do you see?
When we look at imaging studies, when we look at MRI scans and ultrasounds, we don't see joint cracking causing any structural harm in healthy joints. What we normally see is gas bubble production, a bit like what Clodagh was explaining to us. When we look for a patient who's complaining about joint symptoms, there's a couple of things we ask about. So as well as sort of crepitus and crunching and any sort of noises they've noticed from it, the main things we're actually focusing is, have you got any joint pain? Have you got any stiffness associated with it? Because those are sort of like the telltale symptoms that let us know if something's actually wrong with a joint. Have you lost any function within your hands as well?
So what are the kind of cases where joint cracking is associated with a problem then?
So you can sometimes see patients who've got arthritis. So particularly that's what we call true crepitus, which Clodagh was talking about as well, where you hear that sort of creaking noise as bits of one bone rub onto another. And normally they're lined with cartilage and they've got all of this membrane and other bits and pieces between them. But when you start feeling them grating, and sometimes it's not necessarily a noise that you hear, but it's a feeling. It's that feeling of grating, like someone's dragging it along a grater. And that can suggest wear and tear and degeneration within a joint. And that might be something like osteoarthritis, which is really, really common. And it's because it's related to degeneration of tissues and wear and tear. As we get older, we've been on our feet, we've been involved in manual labour and other bits and pieces throughout our lives. The joints naturally wear down, and after a while the joint space decreases and the bones start to rub against each other.
So noise on its own then is fine, like I can continue with my dance career.
Certainly. I wouldn't want you to stop it.
No, I know it's well, it's a sin, isn't it, to hide talent, let's face it.
It most certainly is.
So then what have we learned today? So most joint cracking is normal. It's usually not your bones grinding together. It doesn't automatically mean damage. And cracking your knuckles, you can tell your parents, you can tell your grandparents, everybody who's complaining, it is not laying the groundwork for arthritis.
Noisy joints are just that. They're noisy. The things that matter are the symptoms that we've talked about. So if you notice clicking alongside pain or swelling, redness, loss of movement, or joints that feel unstable or they might give way, those are the cues that you need to get checked out with a doctor.
And while cracking can feel relieving, that relief is usually temporary. It's not a reset, it's not a detox, it's not a realignment, no matter what you see on the internet.
Real joint health looks a lot less dramatic. It's about strength, it's about movement, load management, and giving your body time to adapt.
And huge thanks to Clodagh Toomey, who helped us to make sense of what's actually going on inside our joints, and especially the alarming sounds that come out of mine.
So if you enjoyed this episode, hit subscribe, leave us a review, and share it with someone who cracks their knuckles so they can continue doing it despite all the cries of, "You'll get arthritis!"
And if you've seen a health claim online and thought, that can't possibly be right, then we want to hear from you. Email us at strangehealth@theconversation.com. That's strangehealth, all one word, @theconversation, all one word.com.
Strange Health is produced by Gemma Ware, editing and mixing is by Anouk Nile, and artwork by Alice Mason.
And remember, if a sound alone meant damage, for me every staircase would be a medical emergency.
We don't want that to be the case. Cheers everyone, bye!
Bye!